he was so proud to show me his colonoscopy report. He really was. And he, quote unquote, he's like, I didn't want you to yell at me this year, which I, you have to try to really connect with people.
Hi, everyone, and welcome to New Jersey Nursing Insights Podcast. My name is Sue Weaver, and with me is my co-host, Daria Wazak.
We're your hosts from the New Jersey Collaborating Center for Nursing, and we're excited to get right to it. Today, we're chatting about how public health nurses keep our communities healthy.
That's right, Daria, and I'm pleased to welcome Jan Stralkus and Loletha Johnson. So, Loletha, do you want to start by introducing yourself?
Yes. Hi, everyone. My name is Loletha Johnson, and I am a public health nurse. I currently work with the Department of Health, and I oversee a statewide cancer program. And thank you for having me on this podcast.
We're happy to have you, Loletha. And Jan, can you introduce yourself?
Sure. Hi, I'm Jan Stralkus. I have been working as a nurse practitioner doing house visits in our community in South Jersey, in rural South Jersey.
Well, thank you, Jan, and welcome. So this podcast is on public health nursing, and I like to start with a definition on public health nursing because, to be honest, is new to me. During the pandemic, I think it really came into the spotlight, the work of public health nurses. And I found in the Association of Public Health Nurses, they described public health nursing to occur in a variety of settings, such as health departments, schools, homes, community health centers, clinics, correctional facilities, work sites, out of mobile vans, and even dog sleds. Yes, that made me chuckle too, out of dog sleds.
Thank you for that definition. So much of our community receives care from public health nurses, and this occurs outside of the hospital walls where New Jerseyans don't have access to care for different reasons. Or perhaps they are trying to keep healthy and stay out of the hospital. So let's delve into the historic specialty of public health nursing. Let's start off with Jan. We heard your introduction, but can you speak a little more about what drew you into public health nursing and what your role is like? Can you describe your role?
Sure. Well, I've been a nurse for quite some time, 27 years. I can't believe it. 15 years of that time has been a nurse practitioner. And as of all of us, we've had kind of a colorful resume in terms of what we did. So I first started in the intensive care unit right out of school. And I loved it. I was seeing, critically ill patients during intense high-stake moments. But then I kind of went to the emergency room because of childcare issues, because it was more flexible in terms of timing. Once again, I moved for other family issues. My mom was diagnosed with dementia. I cared for her at home. And I was shocked after all these years of nursing, how little I knew about resources out in the community. And it was until a nurse helped my family kind of navigate this process. And I was like, I could do this. I could be helpful with my experience and my knowledge base. So that's really what made me look into doing house visits. And that's really, I began my community health journey. It's mostly on a personal level. And it was an amazing shift in my practice because I learned that access to care was an issue, transportation, even the know-it-all, how to navigate it. And I've been a nurse for all those years, and I still needed some help, kind of seeing what resources were out there. So that's really what jump-started my interest in community and public health nursing.
So you're a public health nurse practitioner.
Yes.
What parts of New Jersey do you go out to?
So right now I am covering 3 counties in South Jersey. It's Salem County, Cumberland County, and Gloucester County. And it's a very rural, spread out population.
What's a typical visit look like? Take us through like a typical home visit.
In this role, it's interesting. We're really not medically managing anyone. but we're keeping people on task in terms of knowing that the importance of follow-up with provider. A lot of these people don't even have primary care doctors. So we have to kind of help them navigate who is covered in their insurance and network, and how they could even get there is an issue sometimes. So we kind of help making sure that they can get to the doctor. We discuss the importance of follow-up. We discuss the importance of cancer screenings. We do a lot of point of care tests in home, like hemoglobin A1C. Whoever I feel that is necessary, who hasn't had a hemoglobin A1C in the past year, who's has a BMI over 25. There's a criteria of how we kind of screen people, and then we can help them navigate whatever's appropriate for that time. We also talk about vaccines. There's a lot of vaccine hesitancy, so I educate people on that. We do a head-to-toe exam, including blood pressure, heart rate, full foot exam. Some people that are diabetics don't even realize that how important a foot exam is. We also talk about safety. Are they safe in their home? Are they falling? We try to see if there's any hazards in the way. There's just so much involved that I would think that when I say that we don't medically manage them, there's so much else that is necessary in this role.
I'm sure you've seen some safety issues when you're going to people's homes. Can you think of an example of a safety issue that if they're coming to you in a hospital or a clinic, you're not going to see that, right?
Right. So like, for instance, the other day I had a 56-year-old male. He was 350 pounds and was on the third level of an office building that he rented. He physically could not get up and down the stairs. So I had to help him. We actually called together to get him a primary care doc to come into the house because he needed to have home visits.
That's a great example. And let me switch over to Loletha and ask you the same question. Can you describe how you were drawn into public health nursing, and what does your role look like now?
Well, I was drawn into public health nursing as a result of my clinical rotation when I attended the College of New Jersey. And as a matter of fact, it was called Trenton State at the time, but now it's the College of New Jersey. But I sometimes say I graduated from Trenton State. I've been a nurse for about, since 1991. And I recall during my fourth year rotation in the BSN program that I loved public health nursing after rotating at the Ocean County Health Department. That experience was a rewarding experience. I love being out in the community. I love seeing the impact that public health nurses can make in the homes, as Jan mentioned, safety concerns, access issues, so that gave me the passion for this work. So it was enriching, it was encouraging. And as a result of that, once I graduated, I did my requirement as far as working in med surg. And so then I decided I want to launch out into public health nursing. So my first employer at that time, when I launched out, was the Visiting Nurses Association of Trenton, which I believe had been around since 1932. So that is my initial launch. In between that time and now, I've worked at several home care agencies, and I also was a public health nurse with the Burlington County Health Department, actually a bioterrorism nurse, and I oversaw the Medical Reserve Corps. And that is really where my passion has been. So while I was at the Burlington County Health Department, I said, well, you know what? I want to pursue my master's degree. So at that time, I enrolled in the Rutgers MSN program, and I received my master's in advanced community health nurse leadership, which was under the tutelage of Dr. Francis Monet. So after receiving my MSN, I said, okay, well, I hear about all this great stuff that people at state health departments do, so let me explore that opportunity. So in exploring that opportunity, there was a role where the department at that time was looking for someone to implement the National Governors Association Improving Birth Outcomes Working Group, which consisted of a variety of stakeholders, And what we did was we met to come up with recommendations to move the needle in improving birth outcomes for people in New Jersey, reduce the C-section rate. So that's what that work, and that consists of about 86 stakeholders. So that is where my journey as a public health nurse started. And then here I am now, still with a state health department, overseeing a cancer screening program, trying to make an impact to improve the mortality and the morbidity of New Jerseyans. So in a more impactful way, but this work is not done without partners.
And your role now is the first for a nurse. Is this correct?
Yes, yes. So the previous position was held by a physician, like two physicians. And there was one physician that actually established the program. And then once that physician left, another one started. And I assumed the role after that particular physician, who was a pediatrician, actually retired. So I've been in this role since 2021. And we've made really, really leaps and bounds with cancer screening. So yes, I am the first nurse in this role.
Well, thanks. Both you and Jan are making such a difference in so many people's lives. I was wondering, either of you have a particular story or scenario about a patient that was extra special or you felt you really made a meaningful impact with?
Yes. From a population base, what I could say is during Hurricane Sandy, there were so many people that were displaced from their homes and they were moved into shelters. And we had to stand up about 3 to 4 shelters within Burlington County, but over time we scaled it down to 2. So we had people that were living in the shelters for weeks. And the moment that we were able to reunite those people with their family members in partnership with the American Red Cross, as well as the Office of Emergency Management, that was one of the most rewarding. I do remember having a gentleman that was a father who was also in the shelter, and we were able to connect him due to the destruction in certain counties in New Jersey. Many people lost their homes and their place where they actually lived. So one of the most rewarding things was being able to connect those people, with their family or other living opportunities where they could rest, heal, and just go on with life.
Wow, that's really important work. How about you, Jan? Do you have any particular scenarios you want to share with us?
Sure. So my home visits are annual visits. They're like annual well checks. And I had a patient about a month ago I was on the second visit now. So I knew him. And the previous visit, we go through family history and how important it is to identify people who are at risk. And both of his parents actually died of colon cancer. And he was very hesitant in getting a colonoscopy. He was 43 years old. He felt some sort of way about just the anatomy of it all. And he also was fearful of them finding something. He was so proud to show me his colonoscopy report. He really was. And he, quote unquote, he's like, I didn't want you to yell at me this year, which I think, you have to try to really connect with people. So he did end up having a precancerous polyp it was huge and they resected it. They wanted to repeat the colonoscopy in a year. And he was so thankful for me just really connecting with him and showing him that the importance of screening. So I not only did, like in the first visit, I provided education, I answered his questions. I even actually told him how to arrange transportation because that was also an obstacle. So removing those barriers, he went and he got the colonoscopy and I was just really proud of him and telling him again, the importance of follow up and taking care of yourself. So it just reminded me that it's not just clinical skills. It's about being present, being compassionate, and connecting with our patients. And nothing better than in your home when they're comfortable. And like I said, he actually at the end of the visit, he's like, okay, I'll see you next year. It was really a good interaction. And I felt that our work is so important.
Well, that's amazing how you can develop a relationship with the patient like that and he worries about you coming back next year so he gets the work done. You know, I feel like I would need multiple visits to be able to convince somebody, but you have amazing skill. So thank you for your work. Now that we heard your successes, what are the challenges you have? Let's start with Jan in the rural settings you're working in.
I do think that we've made progress, but there are still a ton of gaps. I think access to care is the biggest one, along with mental health services. There's also barriers that include transportation, language barriers, just really overall access to resources, especially in this rural population, just because it's so far out. A specialist may be from Cumberland County. They may have to go to Camden, and an Uber ride is $120. Even just how to get there is an issue. Also, just the know-it-all, just to say, oh, I have to go to the doctor every year. They're like, every year I have to get my eyes checked. I'm a diabetic, poorly controlled, and they haven't gone to the eye doctor in 5 years because one wasn't in network and it was an hour away or whatever the case may be. So I think us just getting out there and educating people and helping them navigate is still an issue. I mean, this one guy that the success story with the colonoscopy, he understood the first time. It may take me 3 or 4 times to, reiterate the importance of follow-up or whatnot.
All right. Thanks, Jan. How about you, Loletha? What are the challenges that you encounter?
Yes, there are actually a plethora of challenges, but there exists opportunity to reduce some of the inequities and the barriers to care, as Jan mentioned, especially for residents who carry the burden of chronic disease as well as cancer. Okay, trying to figure out strategies like how can we reduce the mortality rate and also reduce the burden of the morbidity of these conditions, and being able to increase access and break down some of those long-standing complex issues that contribute to the conditions that we see for groups that are disproportionate. Even with the rural groups, rural health populations, there are so many barriers, right? With the use of tobacco and the chronic diseases that are prevalent there and the lack of access in primary care, it's so dynamic and so complex that I still think that, we have not done enough, and there's still opportunity to break down those barriers, whether it's by where you live, by race and ethnicity, genetic disposition, being able to come up with solutions so that people can live a better quality of life.
Let's focus on the pipeline of public health nurses. What advice do you have for nurses who might be interested in going into public health? Do you need further education beyond the RN education to become a public health nurse? What advice would you give?
So the education that a nurse gets in a BSN program is sufficient as long as there is enough of the community-based care, having that experience with public health nurses in health departments. So what a nurse gets within that basic BSN program experience is actually enough. However, because when you're a public health nurse, you're working autonomously, right? So you don't have the resources that you have when you're working inpatient. So when you're in a home and someone is in the process of expiring, which that happened to one of my colleagues, a man who was released from the hospital, and he sat at the table, him and his wife completed the paperwork, and he said, I think my heart just stopped. And guess what? His heart stopped and he died. And that was like maybe 30 years ago, and I remember that. So being able to have that baseline knowledge, right, and that experience that also improves your judgment, your reaction to situations, knowing what to do, that builds the foundation for being able to work independently. Because when you are working in public health as a visiting nurse, whether you're going out to see pediatric patients or you're running clinics for vaccinations or whether you're doing disease investigation, Having that foundation will help also improve the skills and the care and being able to work independently and autonomously and make good judgment decisions.
What about the community partnerships? I feel like nurses don't learn about that enough in the nursing curriculum. They're not going to necessarily know, all the resources out there in the community to connect people to them. How do you learn about all those resources?
I think mentorship, just like in anything else, like how physicians are residents and work under an attending, how nurses need to have preceptors, how, I've precepted many new nurses, I've precepted many new nurse practitioners. That guidance is so priceless, especially in public health nursing, because you're kind of on an island by yourself out there, especially what I do in terms of doing home visits. And I feel that my experience in the ICU, ER, and long-term care really helped shape my skills and my confidence. And more importantly, it helped me realize what I don't know, if that makes sense. So there's always you can joke, I have multiple phone friends, that are experts in gynecology, cardiology, GI, ID, whatever the specialty is. I have a group on my cell phone who I could always call. And then they're physicians, nurses, nurse practitioners, even you rely on nurses' aides who knows that patient better than probably anybody else at the time. So I feel that mentorship is huge. Like public health, it requires strong communication. You have to be adaptable. You have to be willing to meet people where they are. And that in itself is difficult because you're just going into a stranger's home for the first time, knocking on somebody's door. But I feel that if we take care of our own, like our doctors take care of their residents and our nurses will take care of our nurses, I think, right out of school, as long as you have that preceptorship, mentorship, I think people can thrive. And I feel like additional education can help, but having the passion for community-based care is just as important. So anyone that's interested, we just have to kind of nurture. I think they'd be amazing.
As a visiting nurse, knowing the resources that are out there for your patients, if they're experiencing an issue, that is so important, especially when we're trying to address the social determinant of needs. You may go into a patient's home. They may not have enough money for medications, right? So they may forego eating to pay for their medications or vice versa. So being able to, as Jan mentioned, transportation to get to their appointments, right? So being able to make all those community connections to connect patients to resources. Now, at the state level, when a nurse, most state level positions, they will require a nurse to have MSN. So when you're working in population health at the state level, to try to move the needle on whatever outcome you're trying to improve is unachievable without multi-sectorial partnerships, because it takes the entire industry, whether healthcare industry, business industry, social service industries, all different types of entities to try to move the needle and to build a better quality of life with access and addressing some of those systemic barriers that people experience to care. So because healthcare is so complex, integration is so important, there is not one entity that could do this alone, right? You can't be on an island by yourself, because when you're on an island by yourself, you won't be able to make as much impact. So for the things that I've been able to do and been able to achieve in the work, it takes the partnerships, the commitment, a shared vision to get the job done and to try our best to make a better quality of life for New Jerseyans.
Thanks, Loletha. And what advice would you give to someone who's trying to find their way to get into public health nursing? Where should they start?
So if someone is interested in getting into public health nursing, again, there are the state of New Jersey civil service websites where they can explore job opportunities. They could also explore whatever health department they're looking to work at or they're interested in. Explore the websites to those individual health departments, contact the New Jersey nurses organizations like the New Jersey Administrators of Public Health Nurses is one organization that support nurses. There are a plethora of others, but if they're looking to work at the county level, explore the opportunities at each county level, wherever they're located. If they're looking to explore at the state level, look at the state health department, look at the Civil Service Commission websites, and then they will have postings there.
I also think you can also look for nurses that work in people's homes, because I think there's a new trend that we're trying to see patients where they're at. Even like physical therapists are going to the homes, all these multidisciplinary fields, because really public health is such a team effort that people are now starting to realize that we have to meet them in their homes because of all those barriers, not just transportation, but just to know what the resources are out there. So new nurses could apply to visiting nursing associations, all those different type of companies. And it's really very rewarding and learn how to navigate all the resources that are out there for our patients and our community.
And also, in addition to that, just to expand on what Jan said, many health systems have home care agencies now. Mm-hmm. So exploring even maybe a particular health system that they're currently working in, they can make the transition over to home care. Also, school nursing. School nursing is an opportunity. Also, as Jan mentioned, rehabilitation facilities is also an opportunity. So just as Dr. Weaver said, public health is so broad. It is so broad. There are so many opportunities. So with the shortage in these areas, the likelihood that they would get a position is rather likely. So they increase their chances.
And I agree with Jan. Home care is expected to just boom in the next 10 years. So much more care is going to be provided in the home. So what a great opportunity for nursing students in the nursing pipeline to think of new ways to work as a nurse. They may not have ever thought of that, of these roles. Another thing I'd like to add is that you don't necessarily need to work in a formal public health nursing role, right? You could volunteer for the Medical Reserve Corps. Loletha, you talked about the MRC, and each county in New Jersey has one, right?
Yes, each county in New Jersey has a Medical Reserve Corps, and that is an organization that is deployed not just for pandemics, other natural disasters, also other outbreaks that may be more endemic and not a pandemic. We don't ever want to experience another one of those in our lifetime. And also to do outreach and education, educating the community about preparation, safety, and disease prevention and control as well. So the MRC, they actually do quite a bit because there was a time when we did not have any disasters, right? So everything was more focused on making sure people are caught up with their vaccinations and having the vaccine clinics, right? And also educating the community about safety as well as their chronic diseases. And again, to be a Medical Reserve Corps volunteer, you could be a healthcare provider or you could be a community resident that just wants to engage and impact the world or the state. But it is a national organization.
I was a volunteer for the Medical Reserve Corps and actively completed education and training that were offered in the past. And it was so much fun. One of them was a simulated explosion. The word fun and explosion don't go together, but it was a simulated explosion. And I was in the role of an asthmatic, and I had to pretend I'm an actor, and I had to crawl on the floor and cough, and they put moulage on me, so it looked like I had burns. So it was really an amazing experience, and to work with other disciplines because the firefighters were there with us. So that was an amazing experience, and anyone can do that.
Yeah. And you got a chance to build your acting skills because of that exercise, right?
I was having fun. The last question we like to ask all our guests is how you handle your own self-care. You're all busy professionals. and you do so much. How do you take care of yourself? Let's start with you, Jan.
Sure. Well, self-care has become really important to me, especially like balancing work and family life. I first try to set boundaries and make time to recharge when I can. But as of late, I found a new love for yoga, even though I'm honestly terrible at it. But that's kind of the point for me because it forces me to slow down and to be present and do something that's just for myself without worrying about being perfect. So I really enjoy that. Spending time with your family, trying to get outside, just step away from work whenever I can. Because nursing, as you all know, can be very emotionally demanding and challenging at times. So taking care of yourself is just as important if you want to continue showing up for others. So I guess I'm a yogi, I guess.
What about you, Loletha?
So yes, saying yes, you can neglect yourself and you can get burnt out. So after all these years, I'm starting to learn that I cannot be a yes person all the time. So what I do to relieve my stress is Zumba. I am not a dancer, but it makes me feel like I am. Zumba, walking, and body pump. Those are the things that, and sometimes spin class. So, that's what I do with self-care. And of course, get my hair done, get massages, get all of those things when I can to say that I'm doing something for myself. And as well as travel, traveling just to get away, to get a new environment and to explore different areas. So that's what I do to try to maintain my self-care.
Well, thank you so much, Loletha and Jan, for taking time out to share with us such an amazing specialty that is historic and is only going to be growing as, like we said, more care is going to be delivered in the homes. And I hope you inspired the nurses out there to consider this specialty. And Loletha, I'll see you out in the Zumba room.
I look forward to seeing you.